Welcome to ATCM, this is the Emergency Medicine channel. Last class we discussed about NAV. Today we are going to discuss one small topic that is called Harcourt scoring system. This is to predict the NAV failure in both type 1 respiratory failure and type 2 respiratory failure. So this includes 5 components. This H is for heart rate, A is for acidosis, C is for consciousness, O is for oxygenation and R is for respiratory rate. First thing is the heart rate. If the heart rate is less than or equal to 120, that carries 0 point. If the heart rate is more than or equal to 121, that carries 1 point. Next thing is the acidosis. After starting NAV, we have to take ABG and check the pH. If the pH is more than or equal to 7.35, that carries 0 point. If the pH is in between 7.3 to 7.34, that carries 2 point. If pH is in between 7.25 to 7.29, that carries 3 point. If the pH is in between less than 7.25, that carries 4 point. Then next thing is the GCS of the patient. If patient GCS is 15 out of 15 after starting NAV, then that carries 0 point. If GCS is in between 13 to 14, that carries 2 point. If in between 11 to 12, that carries 5 point. If GCS is less than or equal to 10, that carries 10 points. Then next thing is the oxygenation. In that we have to calculate PF ratio. If PF ratio is more than or equal to 201, that carries 0 point. If it is between 176 to 200, that carries 2 point. If it is between 151 to 175, that carries 3 point. If it is between 126 to 150, that carries 4 point. If it is between 101 to 125, carries 5 point. If it is less than or equal to 100, that carries 6 point. Then next thing is the respiratory rate of the patient. If respiratory rate is less than or equal to 30, that carries 0 point. If it is between 31 to 35, that carries 1 point. If it is between 36 to 40, that carries 2 point. If it is between 41 to 45, that carries 3 point. If it is more than or equal to 46, that carries 4 point. After starting NAV, we have to calculate this Harcourt score after 1 hour, and according to that we can predict the NAV failure. If the Harcourt score is more than 5 after starting NAV, that means there is an 80% chances of NAV failure. So we can go ahead with the early intubation and all. This is a bedside tool to assess the NAV failure. Thank you.